available through the U.S. Department of Health and Human Services. And I'm going to introduce Christy in a moment, but I want to acknowledge two other my colleagues in government, Councilman Kevin Jackson from the City of Providence, and thank him for being here, and Councilman James Diosa from the City of Central Falls. Thank you both for being here. I know that the key to success for many people in this room and for the organizations that you represent include grant funding for capacity building, implementation of broad evidence-based policy, programming, and infrastructure changes. And that's why we're all here today, really to connect you with the resources you need to do the work successfully in your organizations, even when federal funding opportunities have changed dramatically. As you all know, we're confronting pretty serious budget challenges in Washington and very severe cuts in the federal budget. At the same time, we ended earmarks in the Congress, making it more difficult for programs in Rhode Island to do the critical work that they do, that all of you do. Especially at a time when the need for health and human services is at some of the highest levels they've ever been, particularly because of the very fragile economy in our state. So I see one of my responsibilities as a member of Congress from our great state is to make sure that you have the resources you need and access to those resources from the federal government to effectively serve this community in our state. And so I want you to know that I am working very hard on protecting health care reform. That's an important priority for me. I think an important priority for a lot of us in the Congress. And there are those in the leadership of the Congress on the other side of the aisle who have tried, since we got there, to repeal critical health care reforms that were achieved in the Affordable Health Care Act. And the consequences of that, I think, would be really tragic in Rhode Island. It would mean, for example, allowing insurance companies to deny coverage to as many as 54,000 children with pre-existing conditions in our state. It would mean increasing the number of uninsured Rhode Islanders by 36,000. It would mean restricting access to health coverage for 3,600 young adults in Rhode Island. It would mean eliminating tax credits for as many as 27,000 small businesses. It would result in raising the cost of prescription drugs for 18,700 seniors in Medicare Part D donut hole. It would deny preventive care to about 178,000 seniors in our state. And it would increase the cost to hospitals providing uncompensated care by over $50 million annually. So the effects of repealing the Affordable Care Act would be very, very severe in our state. And one of my responsibilities, and one of the reasons I think I was sent to Washington, was to fight for Rhode Islanders, obviously, and I will continue to do everything that I can to make sure that Rhode Islanders have access to quality affordable health care. So I just want to give you a quick update before we begin the presentation of where we are on the implementation of the Affordable Health Care Act. In the 50 months since the President signed the Act into law, significant progress has been made already on improving our nation's health care. In fact, according to a report that was released just yesterday about the impact of the Affordable Care Act on seniors, they concluded that over 5.5 million Medicare beneficiaries use one or more of the preventive benefits, such as mammograms or colonoscopies, now covered under the new health care reform law. So over 5.5 million seniors had access to preventive care. Over 780,000 beneficiaries received an annual wellness visit in the last 6 months. And those are usually important not only to the health and well-being of the people that receive those services, but also in reducing healthcare costs, because ultimately prevention and wellness are one of our key strategies to do that. Other improvements for Medicare beneficiaries under the Affordable Care Act include, as you all know, closing the donut hole by 2020 so that seniors can more easily afford the prescription drugs they need to remain healthy. Wringing out the waste, fraud, and abuse that exists in Medicare so that we can extend the life of the program by making the money going to work for a longer amount of time. There's also been vital insurance reforms under the Affordable Care Act, including insurance companies can no longer discriminate against kids with pre-existing conditions. They can no longer impose annual or lifetime caps on coverage, which is really important, so that you aren't in the middle of treatment for a very serious illness and say, "Oh, you reached your cap. Sorry, you're on your own," which is just which occurred all the time. And also dropping coverage when people are the most ill. It also is ensuring that young adults can stay on their parents' health insurance plans until they're age 26. Insurance companies are also now mandated under the Act to use at least 80% of their premium dollars on healthcare expenses instead of big salaries and bonuses for CEOs, so really directing that the money go into healthcare. It also provides for greater oversight to prevent unreasonable premium increases, which is also very important. And it also, the Healthcare Reform Act provides resources to help underserved communities, and we've obviously seen it already here in Rhode Island. It provides increased financial support for Rhode Island's community health centers to help meet the really growing demand for primary health care services in many neighborhoods all across our state. It offers incentives such as grants and scholarships and loan repayment programs for doctors and nurses and healthcare professionals to serve communities that are facing shortages in these areas, which is also very important. And I know there have been so many people in our state since the enactment of the health reform law that have been working really, really hard and really smartly about its implementation, not only to adopt the initiatives that are in the Act, but to really become a leader in the country in its implementation. And we're already doing that. Rhode Island has received already nearly $40 million in grants through the Affordable Care Act. $1 million to plan for our health exchanges here in Rhode Island, $4.1 million to support capital development in community health centers, and $1.3 million for maternal, infant, and childhood home visiting, just to name a few. So we have come a very long way since healthcare reform was enacted. We have a lot of work to do to make sure that the reforms are implemented and implemented in a way that really serve Rhode Island families and a way that ensures that Rhode Islanders have access to the quality, affordable health care that they need. With all of this in mind, I've assembled the panel today to really help guide you through the grant opportunities that are currently available at the United States Department of Health and Human Services, and to be sure that we maximize our opportunities as a community, as a state, to get all of those dollars we can brought to our state. And to kick off our panel, we are really fortunate to welcome Christy Hager. And Christy was appointed the Regional Director of the United States Department of Health and Human Services, Region 1, in April of 2010. Previously, she was Chief Health Counsel to the Speaker of the Massachusetts House of Representatives during the development, the drafting, and the implementation of the Massachusetts Health Reform Law. So she is a national leader already before she began her work with the administration. She is also a faculty member at the Harvard University School of Public Health and has taught at graduate programs all across New England. She holds a BA from Smith College, a Master's in Public Health from Boston University School of Public Health, and a JD from the University of Connecticut School of Law. So she has a distinct and experienced background, and I know she's doing a spectacular job in her new position. I know she's going to be a great presenter today, and I welcome her and thank you for being here in Rhode Island. Christy, welcome.